One of the procedures I provide is a tongue tie release on infants or babies. And one of my goals is to try to help people with the confusion that surrounds tongue tie releases. Why it's important, what is it, why are we talking about it? And one of the main issues that's causing confusion nowadays is there's not a great way to standardize it, of our thinking, of our diagnosis. Physicians aren't diagnosing it or willing to talk about it as much. Maybe a chiropractor is more, or a lactation consultant is more, but there's a lot of different opinions that surround it. So the most important thing that we have to consider before ever doing one or performing a tongue tie release is it causing a problem? Is there dysfunction? We can't diagnose it based off of just appearance. Just, oh, you can stick your tongue out, or the baby's gaining weight, they're totally fine. That's the wrong way of looking at it. We have to show that there's dysfunction with an assessment. Can the tongue lift up in the front? Can the back of the tongue lift up? Which is, if we think of like an interior or posterior tongue tie, it's just all about the mobility of the whole tongue. And can the function of the tongue, work properly, or is it causing dysfunction to where mom's having pain with feeding and discomfort and doesn't want to breastfeed anymore and so turns to a bottle, or the baby's not gaining weight, or they're taking in too much air, or they're making clicking sounds, or they have reflux, or there's tension in the body, they're uncomfortable, they're not sleeping well, the tongue's not going up. There are a lot of factors that we have to consider. And when we do a tongue tie release on an infant, we have to take into account their age and the severity of the symptoms and what's going on. The younger they are, if they're having failure to thrive issues, or they're not latching well, we may go in and just do the tongue tie release, maybe even a lip tie release that can help the lip flange out and help with the latch and the seal, or cheek ties or buccal ties that help with tension in the latch. Maybe we do that sooner than later, because it's important to help develop those early habits and not allow for dysfunctional compensations or bad habits to develop. The older the kids get, maybe closer to 10 months, 12 months, a little bit older, that if we're going to go in and do a tongue tie release or consider doing one, we have to consider more therapy. Just like older kids and adults have to have myofunctional therapy, younger kids or infants can have therapy as well. What does therapy look like? It could be with a speech-language pathologist, or even some myofunctional therapy that can go in the mouth and work with the tongue, or chiropractic work, working with a chiropractor who's used to working with tethered oral tissues and the tension and dysfunction that's associated with it. Maybe even an occupational therapist for feeding, or a physical therapist to help work through some of these issues. So we can try to work through all these and decompensate these issues beforehand, see how much therapy helps. Maybe therapy alone can help, or if therapy is, we've, from a functional standpoint, we've kind of hit a wall and now we need to release the tension, or from a structural standpoint, I can release the structure, the tension that's there, then we can work with the other providers to help regain function. So it's all about the symptoms, the issues, the dysfunction that's going on for baby and mom, and what the parents or mom's goals are with having the treatment done. Is it to just help them with speech? Is it to help them sleep? Is it, I only want to breastfeed, or I only want to bottle feed? And that helps guide and determine what's the best first step. How long should we wait? How much therapy should you have, before and after the procedure? So there's a lot of things that we have to take into account. And, in Kansas City, we're lucky because, I've been able to partner with a lot of other great providers that I already outlined, from chiropractors to lactation consultants to occupational, physical therapists, speech-language pathologists, myofunctional therapists that are part of our team and that can help you. So very rarely is it ever just a one-time thing, but it takes a team. It takes the commitment from the parents and these other providers, to help. So on the young kids and the babies that, if they're less than, say, a year and a half, a lot of times it's helping with primarily just feeding, but, we can think of it as a long-term investment on health as well, because if there's tension from the tongue that's interfering with feeding, Potentially it could interfere with, feeding when they're older, chewing, swallowing, speech, mouth breathing, orthodontic, our jaw development. So, releasing that tension can have a profound impact on a child's ability to grow and hit each of their growth milestones if there's not dysfunctional tension in the body that's pulling in or retracting in, and that's kind of hindering their ability to grow. So what does a tongue tie procedure look like for an infant? It always starts with our functional assessment, evaluating the mobility and the function of the tongue. We need to prove and show that there's a reason why we're going to do the procedure. Evaluate the tongue, the upper lip, the cheek, the buccal ties, and how all of that is functioning. And then if we decide, hey, the procedure is something that is necessary, you've worked with other providers, you have your aftercare plan in place, and we know that your child is ready for the procedure, then we swaddle the baby, place topical anesthetic, make sure it's as comfortable as possible for them. The topical anesthetic only lasts 15-20 minutes, so it should not interfere with any feeding afterwards. And then the procedure is performed with a light scalpel CO2 laser, so minimal bleeding. Try to keep the wound as small and as conservative as possible. We show you how to do your stretches, your wound care for afterwards to help with healing. We give you a packet of information that goes over what the wound healing is like from day one to all the way through the first month. Go through therapy or methods that can help you for discomfort, for all the way from like Tylenol to homeopathic remedies. Give you a sheet on what the stretches and the aftercare looks like. And then after the procedure, we set up a 1-week follow-up appointment to see how you're doing. And in the meantime, we are always here to help you, with your healing and your baby's health. So you can reach out to us at any point.